Your doctor tells you it's a simple surgery. You'll be back to normal in 6 weeks, they say. You believe them because you've always bounced back before. You've had injuries, illnesses, recoveries. Your body has always cooperated. But something they're not telling you changes everything after you turn 60. My name is Rosa Mendoza. I'm a Filipina caregiver and certified nursing assistant. And I've been working in American hospitals, rehab clinics, and private homes for 18 years. I came to this country from Manila when I was 25, thinking I understood aging from watching my grandmother recover from a fall at 68. She healed in months. I thought all aging bodies work the same way.
I was wrong, and what I've learned in nearly 2 decades might save your life or your independence. Your collagen production drops 40% after 60. Your immune system doesn't fight infection the way it used to. Your bones take longer to fuse. Your muscles atrophy faster when you're immobilized. Your brain's ability to rewire itself after trauma slows down. But most importantly, and this is what kills me after 18 years watching this happen again and again, nobody tells you this. Not the surgeon in the pre op meeting, not the discharge nurse handing you paperwork, not your family telling you, you'll be fine, just rest. You will not be fine. Not if you assume your healing will look like it did at 40. And that assumption, it costs people their independence, their dignity, sometimes their lives. I watched it happen 5 times to patients I cared for deeply. 5 stories that changed everything about how I think about aging in America. 5 families who believed what the doctors told them about recovery timelines, about what's normal, about what their 60, 65, 70, and 73-year-old bodies could do. And then reality hit them differently than anyone expected. I'm a caregiver. I don't write research papers. I don't run clinical trials. What I do is spend 8, 10, 12 hours a day in people's homes watching what actually happens after surgery. I see what the follow up appointments don't catch. I see what the discharge paperwork doesn't mention. I see what families don't understand until it's too late. What I'm about to share comes from 5 real patients I've cared for, real homes, real families, real consequences of believing that 60-year-old bodies heal like 40-year-old bodies. These stories changed how I think about recovery, about aging, about what it really means to say yes to a surgical procedure. If you or someone you love is over 60 and facing surgery, read these stories. They might be the most important thing you read this year. Let me tell you about someone I'll call Mr. David. He was 64 when he had hip arthroscopy at Yale Medical Center in Connecticut. Smart man, retired engineer, very organized. His surgeon had told him 2 weeks of strong pain medication, then you'll be fine. What the surgeon didn't explain was how his 64-year-old body would actually respond. Mr. David did exactly what he was told. He took the oxycodone. 2 weeks passed. The pain was still there, not unbearable, but real. So he called his doctor. Just keep taking it, the office said. Just for a few more weeks. A few more weeks became 3 months. By the time I started visiting his home twice a week, he'd been on strong opioids for almost 4 months. And here's what nobody had explained to him: the medication wasn't allowing his body to heal. Pain after 60 is actually your body's healing signal. It tells you which movements to avoid, which positions hurt your damaged tissues. When you numb that signal completely with strong medication, your brain stops protecting that area. Your muscles atrophy. Your nervous system doesn't relearn how to stabilize that joint. Mr. David was essentially frozen in place, floating on painkillers, getting weaker. When I arrived at his house for my first visit, he was in his recliner. He'd been there most of the day. Rosa, he said, I can't feel my hip anymore. The pain is gone, but I can't feel anything. His wife showed me his medication list, not just the oxycodone, but five other drugs they'd added to manage the side effects: a stool softener, an anti nausea medication, a blood pressure medication because the opioids had wrecked his circulation. He was 15 pounds lighter than his surgery photos. I called his primary care doctor that day and I was firm. Mr. David is not healing. His body is medicated, but he's getting weaker. And he's not doing physical therapy because he's too sedated to care. It took 3 weeks to slowly taper him off. You cannot stop opioids cold turkey. This is critical. But once his mind cleared, once he could actually feel his hip again, something shifted. The pain came back, yes, but now it meant something. It told him which exercises helped and which hurt. His physical therapist, Jennifer, started working with him twice a week. 6 months later, Mr. David walked into my clinic with just a cane. 1 year later, he didn't need it. I wasted 4 months, he told me. 4 months getting weaker, not healing. If someone had told me that pain is actually part of recovery after 60, I would have done this completely differently. And this is what American doctors don't explain. At 60, pain is not your enemy. Numbness is. Mrs. Chen was 71 when she had varicose vein surgery, minimally invasive, the surgeon promised. You'll go home the same day, he said. She did go home the same day, and for 3 days, everything seemed fine. On day four, she called me. I was working at the home care agency in Boston at the time. She said, Rosa, my leg is warm, really warm, and I feel tired. Is that normal? I drove to her house immediately. This is the thing about being a caregiver for 18 years. You learn to hear what's not being said. Mrs. Chen's daughter answered the door and said, she's fine, just resting. But when I saw Mrs. Chen's left leg, I knew. It was red, swollen, warm to the touch. Her temperature was 99.8. Borderline, but combined with the redness, this told me everything. Infection. I called her surgeon's office. She needs to be seen today, I said. She's fine, the nurse said. Post-op swelling is normal. Ice and elevation. I pushed back. This is not normal swelling. This is infection. Mrs. Chen's daughter, who trusted the surgeon more than she trusted me, decided to wait. Let's see how she is tomorrow, she said. Tomorrow, Mrs. Chen's temperature was 101.2. Her leg was dark red. The swelling had spread up to her knee. By the time they got her to the emergency room, she had early cellulitis, a serious skin and tissue infection. The ER doctor was angry. Why wasn't she brought in yesterday? He demanded. They admitted her, started IV antibiotics, and kept her for 4 days. Here's what nobody explains about aging. Your body's inflammatory response after 60 is different. It doesn't always show up the way it does in younger people. A 30-year-old might have a fever of 103 and obvious redness. A 71-year-old might have a temperature of 99.8 and look fine while a dangerous infection is taking hold. The signs are quieter. The progression is sneakier. Mrs. Chen recovered, but she lost 2 weeks to hospitalization. She developed blood clots from the immobility, another complication. She spent 3 months in physical therapy because the infection and clots set her recovery back months. Why didn't someone tell me to watch for this? She asked me later. Why did they make it sound like I just go home and be normal? Because at 71, normal recovery doesn't look like what they tell you in the pre op meeting. Mr. Johnson was 68 when he had rotator cuff surgery in Philadelphia. Routine procedure, 4 to 6 weeks and you'll be good, his surgeon said. His wife, Margaret, told him the same thing. You'll be back to golf in no time, she said, kissing his forehead before the surgery. The problem was that nobody, not the surgeon, not Margaret, not Mr. Johnson himself, understood what his body was actually capable of at 68. Rotator cuff surgery requires immobilization, a sling, no movement for weeks. This sounds simple. But here's what happens in a 68-year-old body that nobody explains. When you immobilize one arm for 6 weeks, your whole body's balance system gets confused. Your brain relies on input from all your limbs to know where you are in space. Remove that input from one side, and suddenly your proprioception, your sense of where your body is, falls apart. Add to that the fact that your inner ear function starts declining after 60, and you've got a recipe for disaster. Week 3 of Mr. Johnson's recovery, he got up in the middle of the night to use the bathroom. Margaret was asleep. He didn't want to wake her. He fell hard, his left hip hitting the bathroom tile. When Margaret found him, he was conscious but in pain. He'd fractured his hip. Now, instead of 6 weeks of recovery, he was looking at hip fracture surgery, 6 weeks of that recovery, and months of physical therapy. One fall, one night, one decision not to ask for help. I was brought in to help with his recovery after the hip surgery. The first thing I did was sit down with Margaret and Mr. Johnson and say something that made them both cry. After 60, you cannot move the way you did before. Your balance isn't the same. Your reflexes aren't the same. Your eyes don't adjust to darkness like they used to. Asking for help isn't weakness. It's acknowledgement of how your body actually works now. Mr. Johnson spent 6 months in physical therapy. He never went back to competitive golf. Margaret had to take a leave from her job to help him. Their lives changed because of one night, one bathroom trip, one assumption that he was capable of moving independently while his body was compromised. I was so stupid, Mr. Johnson told me. So proud. I didn't want to bother Margaret. You weren't stupid, I said. You were 68, and nobody told you the truth about how your body works at 68. Mrs. Rodriguez was 73 when she had knee replacement surgery in New York. Widow, living alone, very independent. The surgeon said she'd be walking in 2 weeks. But within 3 weeks, her daughter noticed something was wrong. Mom's not herself. She told me when she called our agency. She's confused. She's forgetting things. She keeps falling asleep in the middle of conversations. When I met Mrs. Rodriguez, I immediately knew what was happening. Her medications had been stacked on top of each other like a house of cards, and nobody had checked to see if they actually worked together. Let me walk you through what her medication list looked like. Oxycodone for pain, prescribed by surgeon. Gabapentin for nerve pain, added by primary care. Duloxetine for depression and pain, added by her psychiatrist, who didn't know about the other pain meds. Muscle relaxants for stiffness, added by her physical therapist's recommendation. A blood pressure medication because her blood pressure spiked from pain. Sleeping pills because the other medications had disrupted her sleep. Anti-anxiety medication because the confusion was scaring her. 7 medications. None of the doctors prescribing them had talked to each other. The confusion Mrs. Rodriguez was experiencing, that's called polypharmacy. too many medications interacting with each other, and it's devastatingly common in seniors after 60. Your liver doesn't process drugs the way it did at 30. Your kidneys don't filter them the way they used to. The same dose that would be fine at 50 can be toxic at 73. I made an appointment with her primary care doctor and brought the full medication list. These are contradicting each other, I said. She's on three different pain medications. She's on two different psychiatric medications that interact. Her body is confused. It took 2 months to carefully reduce and reorganize her medications. But when we did, Mrs. Rodriguez came back. The real Mrs. Rodriguez, sharp, present, laughing at my jokes again. I thought I was losing my mind, she told me. I thought this was just getting old. I didn't know it was the pills. This is the thing about aging in America that nobody prepares you for. After 60, you need someone, a pharmacist, a geriatrician, a caregiver, to manage your medications like it's their full time job, because it basically is. Mrs. Williams was 66 when she had spinal fusion surgery in Massachusetts. Degenerative disc disease, chronic pain, the surgeon said fusion would fix it. The surgeon promised 6 to 8 weeks of recovery. You'll be back to normal, he said. Her family believed him. Her daughter took 2 weeks off work. Her son planned to help for 1 month. Her husband prepared the house for her quick recovery. But at week 8, Mrs. Williams could barely get out of bed. Her family started to panic. Is something wrong? They asked. Shouldn't you be better by now? And Mrs. Williams, confused and depressed, started to believe something was wrong with her specifically. Why can't I recover like normal people? She asked me when I first met her. Because, I told her gently, the timeline the surgeon gave her was designed for a 45-year-old body, not a 66-year-old body. Here's what actually happens. After spinal fusion at 66 weeks 1-4, you experience severe pain as the surgical trauma settles. You have difficulty sleeping and fear about whether the surgery worked. Weeks 5-8, the pain starts to decrease, but now the real work begins. Your nervous system has to relearn how to work with the fused vertebrae. Your muscles have atrophied from weeks of immobility. Your body hasn't actually healed. It's just gotten past the acute phase. Weeks 9, 1-6 is where real recovery starts. Physical therapy becomes intensive. You're sore, frustrated, and wondering if you'll ever feel normal again. This is when most families think something went wrong. Months 4-6 brings gradual improvement. Small victories, you can walk a little farther, sit a little longer, sleep a little better. 6 to 12 months is when real functional recovery happens. You're doing activities again, but your body still feels different. And it will, forever. Beyond 12 months, you've adapted to your new normal. But it's not the same as before. Mrs. Williams was at week 8 when her family started to think the surgery had failed. She wasn't at week 8 of recovery, she was at the beginning of a month-long process of real healing. I sat down with her whole family and said, Mrs. Williams needs you to understand something. She will not look like she did before. She will not feel like she did before. But she is healing. Slowly, like a 66-year-old body heals. And if you give up on her now, if you tell her something is wrong, you will break her will to keep going. Her family stayed. They adjusted their expectations. It took 7 months, but Mrs. Williams went back to her garden. Not as much as before, not the same way. But she was there, on her knees in the dirt, doing something that mattered to her. If someone had just told me the truth about the timeline, she told me, I wouldn't have spent 4 months terrified that I was broken. I would have known I was just healing the way a 66-year-old heals. After 18 years as a caregiver in America, I've learned something that nobody wants to hear, but everybody needs to know. Your body after 60 is not broken. It's not slow, it's not weak, it's just different. And if you try to force it to heal on a 40-year-old timeline, using 40-year-old assumptions, you will suffer in ways the surgery itself never would have caused. Mr. David learned that pain is part of healing, not the enemy of it. Mrs. Chen learned that infection after 60 looks quiet and sneaky, and you have to watch for it relentlessly. Mr. Johnson learned that asking for help is not weakness, it's survival. Mrs. Rodriguez learned that one medication can become seven, and nobody will notice until you can't remember your own name. Mrs. Williams learned that recovery takes time, and that's okay. If you're over 60 and facing surgery, here's what I tell every patient I work with. Ask your surgeon these questions. What will my healing timeline actually look like at my age? What complications are common in patients my age? How will we know if something is wrong? What medications will I be on and who will manage them? When will I actually be able to do the things I care about? And then, this is critical, find a caregiver, a geriatrician, or someone trained in aging to help you navigate the first months. Not your family, not your neighbor, someone trained to see what doctors miss. Because after 60, you don't heal like you used to, but you will heal. You just have to be honest about how your body actually works now.